guys, it's the Psych NP, and I want to say thank you guys so much for the 1,000 subscribers, guys. It means so much to me. I started this last year. I had no idea it would grow this quickly. So, guys, I have my first ever psychiatric nurse practitioner student. He's actually in his last clinical rotation, so he's about to get ready to go into the real world. So I'm going to do an interview with him, give him a little spotlight, and he's going to answer some questions that you guys have been asking. And he'll be able to give his perspective as a Psych NP student, really ready to go out and graduate, get a job. He's nervous, he's excited, but he's going to do great. His name is Marshall, and let's get to it. Hey guys, it's the Psych NP. I'm precepting my first student. This is Marshall, and he is in his last clinical rotation with me. This is going to be called the Spotlight Series. Marshall, can you introduce yourself and give them a little backstory on you?
Okay, my name is Marshall. I'm a 10-year military veteran, also a 10-year as an RN, and I am going to be completing my master's in about 4 weeks and off to the next stage of the career.
Okay. What made you want to become a Psych NP, Marshall?
Gotta be honest, Psych NP wasn't the initial move. I was going along with the flow of all the other nurses that wanted to advance their practice, and I was going a family nurse practitioner route, and I had to take a semester off. So, true story, I took a semester off, and then when I called the actual student advisor to re-enter the program, they told me I had to wait a year and a half because all the seats were booked. So the actual student advisor recommended the Psych Nurse Practitioner program because there was still so much slots available. I had no idea even what a Psych NP was. So I had to do research before I even agreed. So what I did was I went and spoke to everybody that I knew involved in psych. I got the backdrop on what they do, what scopes of practice do they have, and pretty much the type of patients that they see. And when I really thought about it, I said, I was really interested when I did bedside on the patient's mental well-being as well as their physical well-being. So I thought it would be a good fit to get that experience and to transition my next stage of my career into the route of mental health, because I was so vested in the clinical aspect the first 10 years. So that's why I decided to go ahead with it, and here I am at the end.
Okay. Marshall, can you talk a little bit about your nursing experience?
Nursing experience, yes. I had a vast array of nursing experiences, and I got that from, and this is my recommendation to you all out there, do not put yourself in what we call the nursing box, where in the nursing profession, we always try to classify ourselves as, I'm an ER nurse, I'm an ICU nurse, I'm a tele nurse. Do not put yourself in that box. Give yourself various forms of experience. So I was with a real experienced professor and nurse who told me get as much experiences in the different aspects of nursing as you can. So that's what I did. I started with ICU, I went to the emergency room, I even did cardiac cath, I did population health. So I experienced myself in different forms of nursing. Not only does that make you more knowledgeable, but it makes you more marketable too.
Okay. What is one thing, Marshall, you've learned that would be beneficial to a prospective Psych NP or maybe a current Psych NP student?
I think something that will benefit you first is do your homework. Don't listen to everybody else and their opinions regarding the profession. Don't look at a financial aspect, and don't look at it as being easier. It's different, and different sometimes is not always easy. So it has to be something you're vested in, interested in, and it has to be your niche. Do you enjoy talking to people? Do you enjoy hearing in other individuals' issues? Because it can be a burden to hear these issues and then go home with everything you've heard throughout the day. You have to be able to separate what you heard during the day and how you behave during the evening. So that's one thing I would say. Make sure it's something that you do that's a genuine interest and not a popularity type thing.
Okay, good. How do you balance your work, school, and life balance?
One word: discipline. You have to be disciplined when it comes to all aspects of life, even if you're not in school. So I would say make sure that you plan accordingly. Make sure that you take opportunities to rest. Make sure you take care of yourself first, as far as physically. Um, Make sure that you do certain things that you need to do to be able to provide for not only yourself, but your members of your family, your friends. You have to be able to identify when it's time to rest. You have to be able to identify when it's time to work and pretty much prioritize. And that's how I figure it out. You have to, of course, make a living, but then you also have to do well in your academics. And you also have to have a good relationship with the people around you, because they're the ones supporting you through this time where you have a lot on your plate. So don't isolate, integrate is what I say.
Awesome. I know this is your last practicum, Marshall. We still have several weeks left before we're done, but how prepared do you feel right now to go out on your own and into this real world?
I think I'm very prepared. I think self-initiative is what it takes, especially with a program that like Walden is. You have to be a self-starter, self-motivator. You have to do your homework. Don't just rely on exams and assignments to make you knowledgeable in this field. You have to read, reread, do your homework as far as knowing what the medications are, and you have to expose yourselves into different dynamics. You have to take these practicums seriously, and you have to pretty much put yourself in the role of a provider. And it's very difficult to change the mindset from nurse to provider. In nurse, we're task-oriented. Providers, we're more critical thinking, and we look at the whole picture rather than just accepting what task needs to be done in regards to taking care of the patient. So it's a mindset change, it's a career change, and it takes a lot of responsibility. And with great responsibility comes great power. So you have to understand that too.
Okay. So Marshall, right now, this is the last question. What are your weaknesses right now that you think you still need to work on, before we finish this practicum?
I think the major weakness that I need to work on is being able to relate what a patient reports and not be presumptive in what I'm going to do. You have to take what the patient says and their clinical presentation, and you have to integrate everything that's going on with them before making a decision. Because when you prescribe, they're going to take that medicine, and you have to be able to understand what is going to happen when they take that medicine. Now, it's not an exact science, but you have to have at least a good clinical judgment on what's going to be the outcome when they do take the medicine. What you don't want to do is put a client or a patient in some type of jeopardy that's going to be detrimental to their health, because that would be negative not only for their actual health, but it's going to be negative in the role of a provider, which you are. So you have the responsibility to take it very seriously.
Okay. Thank you so much, Marshall. So Marshall has several weeks with me left in our practicum. He's also going to start his own YouTube channel. That link will be in the description below. And just watch out.
Look out for it, guys. It's called the Big Psych NP.